Hello, I'm Angelo, the Southbridge Town Manager, and I'm here today for another episode of Celebrating Southbridge. I bring this show forward to keep you informed of local issues. But today is probably the most important show that I've done because today the topic is on the coronavirus. I know everyone is talking about this issue right now, but we wanted to bring you a direct message from the town of Southbridge. I'm receiving calls at the town manager's office of what is the town of Southbridge doing about this virus and what role are we playing in that. Well, today is March 12th and it's about 3:30, and I wanted to give you kind of an update of what's going on. I've just left a meeting with a whole group of public health officials. That list included Andrew Pelletier, our health agent, Beth Stevens, our chairman of the Board of Health. It also included a fire chief, who's our emergency management director, Edward Moore, the chief officer of Harrington Hospital, Jeffrey Villar, our school superintendent, Jack Jovan, our town council chairman, Michael Trombley, our senior center director, Karen R. Harnoy, our finance director, Augustine Agalestile, he's the administrator at the Southbridge Rehabilitation Center, myself, Cheryl Owinski, who's the Southbridge public nurse, and the police chief, Shane Woodson. The meeting was called to talk about the coronavirus and making sure that each of us was developing the plans we need to make sure that we can do everything in our power to keep you safe. The goal of the town of Southbridge is to try to deal with this issue effectively as possible and to be able to provide information to the general public to keep you all as safe as possible. A lot of good information was passed among all the different players, a big part of which is to keep you informed in how we're going to do that. But we talked about protocols of how it is that patient will be admitted into the hospital if they had a coronavirus, how our ambulance service was going to deal with the issue, how our police department was going to deal with the issue, issues about the schools and what happens if the schools had to close. What do we do in our nursing home if we have a patient get sick in our nursing home? So I want you to know that all the town officials are taking this issue extremely seriously, and all of us are discussing amongst each other how to make sure that we are working together as a team to make sure that we deal with this issue appropriately. Now, with that in mind, we're going to communicate among ourselves and make sure we stay in a loop of town officials to make sure we know what each part of the town is doing as it deals with this issue. But today we want to inform you of what's happening in town right now. And with that in mind, I have Andrew Pelletier, who's our health agent, to discuss some of the issues around the coronavirus. Now, Andy, thank you. First, welcome to the show.
Thanks for having me back.
I want to thank you. I know you're in a kind of a crucial role here, and you're going to be a busy guy over the next number of months dealing with this issue. So let's first start off with basics, right? And I think you're hearing this all throughout Facebook and all through different sites. What should people do to keep safe as it relates to disease? What kind of common precautionary steps can people do to make sure that they lower the risk of getting this type of disease?
Okay. We should all keep in mind that this is a very flu-like disease. Mm-hmm. And when I say that, the symptoms are very similar to the flu symptoms, but the spread is very similar to the flu. It spreads through droplets from people sneezing, just vaporizing when they breathe. So we're going to preach the similar prevention as we would with the flu. We're going to preach that we want a social distance. Yeah, we don't want you to not go visit your mother, but put a distance between you and her so that when you sneeze, it falls to the ground before it reaches her. Want to encourage a lot of hand washing. This virus can stay on an inanimate surface for up to 9 days, I believe, after it's. So if it lands on a door handle, it is still active. Unlike a lot of viruses, it's still active up to 9 days after it gets on that door handle. So frequent hand washing. You can't control what you touch because you have to get in and out of buildings. You have to answer that phone, but you can control getting the virus off your hands. Cover your coughs. It's spread by the droplets from sneezing and breathing. So make sure you cover your coughs, not with your hands because, again, you don't want to. You do handshaking. We're going to encourage you not to do handshaking, but there's some contacts you can't avoid. Cover it with your sleeve, with your elbow. Very rarely does anybody go and touch your elbow. So just really logical thinking, social distancing is going to be the best way to prevent you from catching this disease.
So, Andy, one of the big issues that we're really concerned about is the impact on senior citizens. The seniors in our community are the most susceptible to this, and it's the most dangerous to them because they might have already conditions that make their health weaker and not as strong as it could be. Tell me what we should do in terms of our senior citizens, and we could talk about the congregation, all those kind of issues, but what do we need to do to try to protect our seniors from this particular disease?
Well, as I am approaching senior citizen myself, I think I actually qualify because I do have my AARP, but I don't want to admit that I'm there yet. So I become more and more conscious of the concerns of the senior citizens. They are a highly susceptible population for this. The protection of them right now, there is no vaccine yet to fight this disease. So the protection of them is the same as the protection of everybody else, but more conscious of it. A lot of times they'll receive their meals from Meals on Wheels. I know I have a mother-in-law who loves to go out to the church suppers and the community events. Got to be aware of your surroundings. I encourage the seniors not to go out to these events until this thing starts to peter down a little bit. The social environment is what's going to spread the disease. So the same, wash your hands, cover your coughs, social distancing, but more extreme. Be more conscious of it.
So a couple of points to that. If you happen to be sick, you have cold like something like that, that is not the time you want to visit your parents now. You want to be ultra careful when you're sick. The best thing you can do is stay home. Don't go to work. Don't show up at events. Do whatever you can do. Isolating yourself until your symptoms are gone is really, really crucial at this time to help keep the disease from spreading. I do want to point out one of the people we just met with was from the Southbridge Rehabilitation Center, which deals with all senior citizens who are housed there. Places like that and even a hospital are going to start stopping visitors from coming in on a regular basis because they can't afford to have the disease spread either throughout the hospital or throughout the rehabilitation center. That may be very frustrating to you if you have a family member in one of these facilities, but the truth is what they're doing is to protect the family member themselves and to protect you and to protect all the hospital staff and all the nursing home staff to make sure this disease doesn't spread. So I know it's going to be frustrating. I know it might make you angry, but please, please support the hospital, support the nursing homes, and communicate through Skype and Facebook and through other kinds of things. Do not be angry with the staff because they won't let you in to see your parents or relatives. Yeah. Andy, do you want to talk a little bit about that? Because that's very concerning.
History has proven time and time again, if a communicable disease gets into these establishments, these institutional type establishments, it is miserable to get it out of it. So what could affect one or two persons at home, it's an institutional type establishment. It's enclosed, it's limited access. If it gets in there, it's going to spread throughout the establishment and become a greater problem than it has to be. Be very cognizant, even if the establishment hasn't created limited visitation and other controls, you should be very cognizant of your own condition, of who you've been exposed to, and don't bring it into these type of institutional establishments. The hospitals, the nursing homes, they're going to breed within that and spread throughout the whole population there.
This disease seems to affect different people differently. You may not even have any symptoms. It may in fact be your carrier. So even though you feel healthy, you don't feel like you're sick, you may be in fact carrying disease into other people. That's why the hospitals, the nursing homes have to be very, very cautious as they come in. So, in the beginning of this disease, I think it was okay, people coming in from, be it places like Iran or Italy, it's high-risk areas. But as the disease spreads from people to people, it's no longer those people from other countries that have been in other countries. It's, I got it from my sister, my brother, thing. And so very rapidly, it's not about where you've been. It's about who you've been exposed to. Is that correct?
Correct. There is an attitude that I'm only going to catch it if I get into big groups. But there are over 90 cases in Massachusetts right now, both presumptive and or proven. And a good half of them, we can't find a common link on why they have it. They just have it. So it's no longer necessarily the big groups. I mean, the big groups are still the biggest threat, but because obviously the biggest exposure in a big group. But it's going individual to individual now, and we got to be cognizant of it. Can't stress enough. If you are showing symptoms, go to your room and hang out. Just isolate yourself until you're sure that you're good.
One of the things I want to do right now is, myself and Andy, we can give you all kinds of information. We can print out all kinds of documents. But frankly, it's right on websites right now where you can get all the information you want. So you can really pick and choose. I'm going to give you the name of the three of the most popular websites, the most informational websites, and on those websites you can get everything from symptoms to treatment to how to deal with family members to isolating to how to clean your home, all those kind of things. So I'm going to start first with the Massachusetts Department of Public Health. That's one of the main ones. It's in MassGov. And you'll see right at the top it'll say go to coronavirus and they'll give you that website. So it's very easy. Again, Mass Department of Public Health. You'll be able to find that information. It's at the very top of the page. Centers for Disease Control and Prevention. That's through the United States government. Centers for Disease Control and Prevention. If you go to that site, you'll see a thing that says coronavirus. Check it in, click it, and you'll go right to it. The last one is the World Health Organization. You've probably seen on the news. They're reporting about what's going on worldwide. So those are three of the major websites. And believe me, if you want to learn about coronavirus and you want to get any kind of detail or how to help your family or how to do anything, how it impacts schools, how it affects government, how it affects businesses, how to do that, those three sources of information will give you anything you could possibly want. Now, one of the other things we're going to be doing is we have what's called reverse 911. You might have got it. It's a phone call from our health officials or our fire department, basically warning you of some kind of storm or some major emergency. We are going to be developing a message in conjunction with Harrington Hospital and our health department. We're going to tailor a message, a basic information message, just letting you know that we are working on this issue, who the players are involved in dealing with this issue, and we're going to do everything we can to continue to provide information as we learn about it. This is changing every day, isn't it, Andy?
It is. To Ron's point that he just made, the reverse 911 in Massachusetts, in Southbridge, is a voluntary situation, so you will not get the message unless you've signed up to receive these 911 calls. You would go to the town webpage, fire department, or you could call the fire department and they can tell you how to sign up for it. Strongly encourage this. This is going to be the most accurate town information, and a lot of you will be depending on Facebooks and focus on Southbridge. Good place to get an idea. However, research the idea. That's a lot of opinions, not necessarily fact. So if you see something on those pages, reach out. Go on these web pages that Mr. San Angelo just mentioned, and confirm it before you pass on the news. The most detrimental thing right now is erroneous gossip going on through some of these web pages. And I'm not bashing the web pages. I just think that you need to confirm your facts before you start spreading the word.
So let's talk about that, right? If you're in Southbridge, you may see somebody on Facebook quoted, there was a case confirmed at Harrington Hospital. As of right now, 3/12/2020, excuse me, there are no confirmed cases. I just met with the president and CEO of Harrington Hospital. As of right now, there's no confirmed cases whatsoever. So just because you see it on Facebook, don't necessarily believe that that's true. If you're really concerned, reach out to Andy Pelletier, the Department of Public Health. Reach out to my office and we can answer those kind of questions. Please, if you're looking at the CDC website or the State Department of Health, you'll get accurate information. But, sometimes it's accurate on Facebook, other times it's completely wrong, and it can be very dangerous. If you're posting information, be careful of what you post, because we are trying to get correct information out to the general public, and we don't need panic created by people that are just stirring things up, so to speak. Now,
as of right now, actually, I can only speak for the last 24 hours, but as of 24 hours ago, there was only one case documented in central Massachusetts. In Worcester County, there was one case. No other cases have been proven presumptive or confirmed. So, and we get that update every 24 hours. So right now, one case in central Mass in Worcester.
And that was as of today, because I'm looking at the different counties, and I'll even label them out for you. If you look on the Department of Public Health website for Massachusetts, it shows 6 confirmed cases, 89 presumptive, so they don't know for sure if they have it or not. But there's 7 in Berkshire County, 1 in Essex County. Most of them are in Middlesex, which is 44, Norfolk 23, Suffolk 19, and Worcester 1. So that's where we are right now. And a lot of these cases really in Massachusetts are related to a Biogen conference that happened. So 77 of those cases are directly related to that specific event. So if you're not associated with anybody who went to that event, good. But you may not know who went to that event. So You always want to be careful. So, again, I want to stress steps to present or prevent the illness. That's in our mind right now. That's one of the biggest things you can do as an individual. Take steps to prevent the illness. So we're gonna start with something Andy said. Clean your hands often. Wash your hands with soap and water for at least 20 seconds, especially after you've been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. I always find myself leaning on my face with my hands. You're gonna have to retrace your habits, right, Andy?
It's ridiculous. I believe just during this conversation, I believe I touch my face like this. I believe I rub my beard. It's hard to break the habits.
Yep.
When I leave this, I'm going to go wash my hands because I don't want to transmit anything that I might have to somebody else, and I don't want to transmit anything that somebody else has into my danger zone, if you will, my vulnerability zone.
Andy talked about it earlier. Avoid close contact, right? It's sad because many of us go to church every week. We go out to the local, potluck supper, whatever it is. And all those events are great because they raise money for charity, they raise money for the churches. Now, particularly if you're at high risk, you need to avoid those things. If you're a senior, it's probably not the best time to go where there's a large group of people. So you really need to be careful. Even young people, while you're safer because the risk is lower for you, again, having caution, being a little preventive, because you don't know, you could be a carrier as well as trying to avoid it yourself. So do everything you can to avoid large groups. If you're in a group, try to keep a few feet away, enough space between you and that person, so that you don't risk either contaminating them or getting contaminated yourself. Stay at home if you're sick. That's a real problem. I think most of us are used to, if we have a small cold, I go to work. I can't afford to take the time off. I'm a little sick time. Andy, should you be going to work if you're sick?
In no case should you go to work if you're sick, especially if you have a fever, because if it's not the coronavirus, it could be the flu. If it's not the flu, it could be pneumonia. Fevers are the quintessential, you got to stay home. They are usually related to some kind of communicable diseases or food poisoning type stuff. But you're running a fever, stay home. Don't take the risk.
Now, if you have the symptoms, now again, just because you have the symptoms doesn't mean you have coronavirus. You might just simply have a cold, right? Mm-hmm. So you just don't know. If you can, get a mask, cover your face. You're in your own house. You want to protect the people you love and all the other family members. Please do everything you can to stay away from them, not be as close. If you can get yourself a mask to cover your face, that would be huge in order to protect them. Do everything you can. Again, try to isolate yourself to your own room if you can. Try not to have that direct contact if you can help it until the symptoms are gone. I know they're talking about 14 days, but enough time to make sure that you're okay. Clean and disinfect. Sandy, we were talking about that even in town hall. How do we clean and disinfect? I know our police department is doing it. Community services is doing it. We're trying to clean buildings. Tell us about that.
Most important thing you can do for cleaning and disinfecting is be attentive to those surfaces that are commonly touched. Your door handles, your telephones, your toilet paper dispenser, your toilet flusher. What you're looking for is a 70% alcohol solution. This coronavirus is very vulnerable to alcohol sanitizers. So I would look to the alcohol sanitizers and be attentive to those common touched areas.
Now, if you are sick and you think you possibly might have the coronavirus and you're concerned about it and you're feeling very severe symptoms and you need to either go by ambulance or to the hospital, you need to call in advance. You need to let those public health officials know that you might have the disease so they can protect themselves as well. So you're going to see the Southbridge Fire Department, who runs our ambulances service, you're going to see them taking extra precaution. They may be wearing masks, they may be doing things to protect themselves. But when you call 911, you should immediately let them know you're concerned you might have coronavirus so that the public health officials, the ambulance drivers, the hospital, can all be prepared to deal with you in that case. They want to make sure, again, that they don't get sick. They want to make sure that people in the hospital don't get sick. If you need to go to the emergency room, the same is true. You just don't show up at the emergency room, get into a group of people and say, hey, I'm sick, I think I got it. You want to call them ahead of time, let them know you're coming so they can make arrangements to bring you in such a way is that you don't infect anybody else. It's really crucial that while you're sick, we need to make sure that you don't get everybody else sick.
Again, Ron talks specifically of the coronavirus. This goes for any fever carrying and the flu, any disease that you think could be transmitted through respiratory. You got to let the people know because you are contagious. They're going to come in with a mask on. If you have a mask, one mask on you as an ill person can possibly prevent several people around you from getting ill. So if you have a mask, it should be on the sick person, not on the well people around them. You're going to save more people with one mask on the sick person than you are with one mask being shared by 4 healthy people.
At some point, there could be a decision through the health agent and through the school system that we might have to close the schools. Right now, be blatantly honest with you, there's a lot of nervousness about this. We're all a little bit nervous. A lot of us have never gone through this before. There's a lot of apprehension, a lot of concern. There's concern among teachers. There's concern among my own staff here at Town Hall. You know what? We can't panic. We have to be reasonable here. We have to be responsible. We just can't shut down the world. So while we want to take reasonable precautions, again, everything just can't close. If we feel, if the Board of Health feels, if the health agent feels, if the schools feel there's a serious threat, they will close the schools and take care of that. That leads to a lot of problems. If the schools close, parents don't have anybody to watch their children. Parents can't go to work. Nurses, doctors, they can't go to work because they have to take care of their children. So we want to keep the schools open as long as it's safe. We want to keep them open so that we can continue to do business, that we have the staff at the hospitals, because literally if the schools closed, 20% of the hospital staff would disappear because they have to take care of their own children. So I just want you to know there's a lot of complex issues here, but the town of Southbridge is working with all of the officials to discuss those issues, to plan for those issues, and to handle them the best way possible. I can't stress enough. I know there's things going on with the stock market. I know there's concerns you're hearing. Every time you turn on TV, you're hearing about this disease. You can't panic about it. You have to just use your own common sense. Be safe, be cautious, make sure you protect yourself, and we'll all get through this. In the United States, we have the best healthcare professionals in the world. And we have people like Andy, the local health directors that are really working hard. The hospital's involved, nursing homes are involved, the school system's involved. The ambulances services are involved. We're all discussing what we can do. Andy, do you think we're on the right track so far?
I think if we can get the people to realize that prevention is in their hands, that practice the social distancing, practice the hand washing, covering the sneeze, I think we can curtail this thing. We're not going to kill it that way. It's out there. It's real. But history has shown us, H1N1, SARS, the key to prevention is with you, the individual, or at least the key to limit the spread. I think if we can practice those, we can slow this thing down and hopefully hold our own until we get a vaccine developed. There's a company out there who's already proposing a vaccine. It's just got to go through the testing phase. So 6 months, maybe a year, we get one. But it's up to us to stop it from spreading ridiculously until that time. Again, we saw it at H1N1 and we totally curtailed H1N1. So I think it's doable.
Yeah, but just to let you know, the Southbridge Town Council is engaged in this issue. The Southbridge Board of Health is engaged in this issue. So all the parties are thinking about this, and we're trying to plan and get ready before it affects this area, right? So the earlier we can plan, the earlier we think about this, the better we are to deal with problems when they exist. And Andy's been a big part of that planning. So I want to thank you for your involvement in helping to plan and deal with this issue.
Thank you. I have never been on first name basis with most of the Massachusetts State DPH. We're in constant contact. We're getting their guidance. They're relying on us reporting. We're relying on them advising. It's a good cooperation, and I think it's going to carry us to the end of this thing.
Again, I want to thank you for watching this show today, and I want to assure you we're going to do our very best to do everything we can to protect citizens, and we're going to do it in a cooperative effort among all public health officials, all town officials. Our goal is to work as well as we can together to ensure that you are kept up to date on the information as it comes out. And truthfully, it's difficult for us because the world's changing literally on a daily basis as we learn more about this particular disease. Stay calm, use common sense, and again, I appreciate you listening to me as your town manager. I'm going to promise you that I'm going to do everything I can to make sure that this process runs smoothly. So to all the health professionals out there, I want to thank you for the service you're doing to our town. And we're going to continue to meet and go through this on a regular basis to make sure that everything is good. Thank you and have a great day.
Thank you.